Welcome back to Second Chance Histories, where we explore the extraordinary moments that challenge our understanding of life, death, and the mysterious ways that knowledge can transcend the boundaries of what should be possible. Today's story takes us to the intensive care unit of Memorial Hospital in Phoenix, Arizona, where 45-year-old Dr. Sarah Chen experienced something that would forever change her understanding of medicine, mortality, and the profound connections that exist between all living beings. When Dr. Chen flatlined for 7 minutes during emergency surgery, she returned with knowledge that she couldn't possibly have acquired, knowledge that would save 12 lives in a single day and revolutionize her approach to healing. This is the story of the second breath, where a physician's brush with death gave her insights into life that no medical school could teach, and proved that sometimes the most profound healing comes from understanding connections that exist beyond the reach of conventional science. Dr. Sarah Michelle Chen had dedicated her entire adult life to emergency medicine. At 45, she was the head of the emergency department at Memorial Hospital, a position she had earned through 15 years of exceptional service, innovative patient care protocols, and an almost supernatural ability to diagnose complex conditions that other physicians missed. Sarah had chosen emergency medicine because she thrived in high-pressure situations where quick thinking and decisive action could mean the difference between life and death. She was known throughout the hospital for her diagnostic intuition, her calm demeanor during medical crises, and her unwavering commitment to saving every patient who came through the emergency department doors. Dr. Chen has this ability to see patterns that other doctors miss, said Dr. Michael Rodriguez, her colleague for over 8 years. She can walk into a room and immediately sense when something is more serious than it initially appears. She's saved countless lives just by trusting her instincts. But Sarah's dedication to her patients came at a personal cost. She worked 60-hour weeks regularly, rarely took vacations, and had sacrificed most of her personal relationships to her medical career. At 45, she was unmarried, had few close friendships, and lived alone in an apartment that felt more like a place to sleep between shifts than a real home. Sarah told herself that her sacrifice was worthwhile, that saving lives was more important than having a conventional personal life. But privately, she sometimes wondered if her single-minded focus on medicine had left her missing some essential understanding about what it meant to truly live. This question would prove more prophetic than Sarah could have imagined. On a busy Tuesday morning in March 2020, Sarah was beginning what she expected to be a routine shift when she began experiencing unusual symptoms. She felt dizzy during patient rounds, had difficulty concentrating on medical charts, and noticed an irregular heartbeat that she initially attributed to too much caffeine and too little sleep. "Sarah," Dr. Rodriguez observed during their morning briefing, "you look pale. Are you feeling okay?" Sarah dismissed his concern. "Just tired. I'll be fine after some coffee." But as the morning progressed, Sarah's symptoms worsened. She began experiencing chest pain, shortness of breath, and a sense of impending doom that she recognized from her medical training as signs of a serious cardiac event. At 11:30 a.m., while examining a patient with chest pain, Sarah suddenly collapsed. The irony was not lost on her colleagues. The emergency physician was experiencing her own emergency in her own department. "Code Blue, Emergency Department," announced the hospital intercom. "Code Blue, Emergency Department." Dr. Rodriguez and the emergency team immediately began working on Sarah, recognizing the signs of a massive heart attack. Despite their quick response and expert care, Sarah went into cardiac arrest and flatlined. "We've lost her pulse," announced nurse Jennifer Martinez, monitoring Sarah's vital signs. "No heartbeat, no blood pressure." For the next 7 minutes, Sarah's colleagues worked frantically to restore her heartbeat through CPR, defibrillation, and emergency medications. From a medical standpoint, Dr. Sarah Chen was clinically dead for 7 minutes and 12 seconds. But what Sarah experienced during those 7 minutes would challenge everything she thought she knew about consciousness, life, and the connections between human beings. During her 7 minutes of clinical death, Sarah found herself in a state of consciousness unlike anything she had ever experienced. She was aware of herself as Sarah Chen, but she was also somehow aware of multiple other perspectives simultaneously, as if she could experience the world through many different sets of eyes and minds at once. Initially, Sarah could perceive her own emergency room from above, watching her colleagues work desperately to save her life. She could see the organized chaos of the resuscitation effort, hear the controlled urgency in her colleagues' voices, and even sense their emotional states, their professional focus mixed with personal concern for a friend and colleague. But as the experience continued, Sarah's awareness expanded beyond the emergency room to encompass other parts of the hospital. She began to perceive patients throughout Memorial Hospital with startling clarity, not just their physical conditions but their emotional states, their fears, their hopes, and most remarkably, their undiagnosed medical conditions that were not apparent to their treating physicians. Sarah found herself aware of Mrs. Elena Rodriguez in room 312, who had been admitted with what appeared to be anxiety but was actually experiencing the early stages of a heart attack that traditional testing hadn't yet detected. Sarah could somehow sense the subtle cardiac electrical abnormalities that were not yet showing on Mrs. Rodriguez's EKG. She became aware of Mr. James Thompson in the pediatric ward, visiting his daughter who was being treated for what doctors believed was a severe flu. But Sarah could somehow perceive that the child was actually in the early stages of meningitis, a life-threatening condition that would not be obvious for several more hours. Throughout the hospital, Sarah's expanded consciousness identified patient after patient who was experiencing medical conditions that their doctors had not yet recognized. She could sense internal bleeding that wasn't yet severe enough to cause obvious symptoms, early-stage infections that laboratory tests hadn't yet detected, and medication reactions that would soon become dangerous. Most remarkably, Sarah wasn't just perceiving these conditions, she was understanding exactly what needed to be done to address them, as if she had access to a vast medical knowledge that extended far beyond her own training and experience. After 7 minutes and 12 seconds of clinical death, Sarah's heart suddenly resumed beating. Her colleagues had been preparing to declare the resuscitation attempt unsuccessful when Sarah's cardiac monitor showed a strong, regular heartbeat returning spontaneously. "We've got her back," Dr. Rodriguez announced with relief. Strong pulse, blood pressure returning to normal. But Sarah's return to consciousness was unlike anything her colleagues had ever witnessed. Instead of the gradual, confused awakening typical of patients who had been unconscious, Sarah immediately opened her eyes with complete alertness and began speaking with urgent clarity. "Michael," Sarah said to Dr. Rodriguez, her first words after returning from clinical death, "you need to check Mrs. Rodriguez in room 312 immediately. She's having a heart attack, not an anxiety disorder. Order a troponin test and start cardiac protocols." Dr. Rodriguez was stunned. Sarah had been unconscious and clinically dead for over 7 minutes. There was no way she could know about Mrs. Rodriguez's condition or even that Mrs. Rodriguez was a patient in the hospital. "Sarah, you've been unconscious. You need to rest and let us examine you." "There's no time," Sarah insisted with an urgency that her colleagues had never seen from her. "Mrs. Rodriguez is having an MI that won't show on EKG for another hour. The Thompson child in pediatrics has meningitis, not flu. You need to do a spinal tap immediately. And Mr. Patterson in room 218 is developing a bowel obstruction that will become critical in the next 2 hours." Sarah continued listing patient after patient throughout the hospital, providing specific diagnostic information about conditions that hadn't yet been recognized by their treating physicians. Her colleagues were amazed not just by the scope of her knowledge, but by the absolute certainty with which she delivered her assessments. Despite their skepticism about Sarah's claims, her colleagues decided to investigate the conditions she had described. What they discovered would challenge their understanding of medical diagnosis and human consciousness. Mrs. Elena Rodriguez in room 312 had indeed been experiencing a heart attack. When Dr. Rodriguez ordered the cardiac enzymes that Sarah had requested, they confirmed elevated troponin levels indicating significant cardiac damage. Mrs. Rodriguez was immediately moved to the cardiac catheterization lab, where they discovered a 95% blockage in her main coronary artery. "If we hadn't caught this when we did," the cardiologist told Dr. Rodriguez, "Mrs. Rodriguez would have had a massive, potentially fatal heart attack within the next few hours." How did Dr. Chen know to order these tests? The Thompson child in pediatrics was indeed in the early stages of bacterial meningitis. The spinal tap that Sarah had urgently requested revealed the infection that would have become life-threatening if not treated immediately. Mr. Patterson in room 218 was developing the bowel obstruction that Sarah had predicted. When doctors examined him based on Sarah's assessment, they discovered early signs of intestinal blockage that required immediate surgical intervention. One by one, every diagnosis that Sarah had provided during her first minutes of consciousness proved to be accurate. 12 patients throughout Memorial Hospital were found to have serious, previously undetected conditions that required immediate medical attention. "It's impossible," Dr. Rodriguez confided to the hospital administrator. Sarah was clinically dead for over 7 minutes. She couldn't have examined these patients or reviewed their charts. Yet she provided specific diagnostic information that saved 12 lives. "I've been practicing medicine for 20 years, and I've never seen anything like this." Word of Sarah's extraordinary diagnostic feat quickly spread throughout the medical community. Dr. Patricia Williamson, a neurologist who specialized in consciousness studies, requested permission to interview Sarah and investigate what had happened during her 7 minutes of clinical death. "Dr. Chen," Dr. Williamson began, "I want you to describe in as much detail as possible what you experienced during the time you were unconscious." Sarah described her expanded consciousness, her ability to perceive patients throughout the hospital, and her access to medical knowledge that seemed to extend beyond her own training and experience. "The strangest thing," Sarah explained, "is that I wasn't just seeing these patients, I was somehow experiencing their conditions from the inside. I could feel Mrs. Rodriguez's cardiac distress, sense the Thompson child's neurological inflammation, and perceive Mr. Patterson's intestinal blockage as if I were experiencing their symptoms myself." Dr. Williamson documented Sarah's account and compared it with the medical records of the 12 patients Sarah had diagnosed. The accuracy of Sarah's assessments was unprecedented in medical literature. What Dr. Chen described experiencing, Dr. Williamson concluded, represents either an extraordinary coincidence, an unknown form of consciousness expansion, or some kind of intuitive diagnostic ability that we don't yet understand scientifically. Dr. Williamson arranged for Sarah to undergo extensive neurological testing, hoping to understand whether her near-death experience had altered her brain function in ways that might explain her enhanced diagnostic abilities. In the weeks following her cardiac arrest, Sarah discovered that her extraordinary diagnostic intuition had not disappeared. She continued to demonstrate an uncanny ability to identify serious medical conditions that other physicians missed, often sensing problems in patients before obvious symptoms developed. "It's like I can perceive the body's systems in ways I never could before," Sarah explained to Dr. Williamson during one of their research sessions. "I can sense when someone's biochemistry is out of balance, when an infection is beginning to take hold, or when organ systems are starting to fail, even when traditional diagnostic tests don't yet show abnormalities." Sarah's enhanced abilities transformed her effectiveness as an emergency physician. Her diagnostic accuracy improved dramatically, her patients experienced better outcomes, and she began catching serious conditions that would have been missed using conventional diagnostic approaches. Dr. Michael Rodriguez, who worked closely with Sarah, documented case after case where Sarah's intuitive assessments proved to be correct even when they contradicted initial test results. Sarah has developed this ability to see the whole patient in ways that our standard diagnostic tools can't match, Dr. Rodriguez observed. She's preventing medical emergencies by identifying problems before they become critical. It's revolutionizing how we think about diagnosis and patient care. As word of Sarah's abilities spread throughout the medical community, physicians from other hospitals began consulting with her on difficult diagnostic cases. Sarah found herself helping doctors across the country identify conditions that had baffled medical teams. Dr. James Patterson, chief of medicine at Seattle General Hospital, consulted with Sarah about a patient who had been experiencing unexplained symptoms for months. Dr. Chen took one look at the patient's history and immediately identified a rare autoimmune condition that our entire diagnostic team had missed, Dr. Patterson reported. Her assessment led to treatment that completely resolved the patient's symptoms. I don't know how she does it, but her diagnostic insight is unlike anything I've encountered in 30 years of medicine. Sarah began teaching other physicians to pay attention to subtle intuitive signals that might indicate undiagnosed conditions. She developed what she called holistic diagnostic awareness, approaches to patient assessment that integrated traditional medical knowledge with intuitive perception of the patient's overall condition. Most physicians are trained to focus on specific symptoms and test results, Sarah explained during a medical conference presentation. But sometimes the most important diagnostic information comes from stepping back and perceiving the patient as a whole system. When you learn to sense the overall pattern of someone's health, you can often identify problems before they show up in conventional testing. Dr. Williamson's research into Sarah's case revealed several fascinating findings about consciousness and medical diagnosis. Brain scans showed that Sarah's near-death experience had resulted in increased connectivity between different regions of her brain, particularly areas associated with pattern recognition, emotional processing, and sensory integration. Dr. Chen's brain appears to process medical information differently than it did before her cardiac arrest, Dr. Williamson explained. The increased neural connectivity might explain her enhanced ability to synthesize subtle diagnostic clues into accurate assessments. The research also revealed that Sarah's diagnostic accuracy was highest when she trusted her initial intuitive impressions rather than relying solely on analytical reasoning. It's as if Dr. Chen's near-death experience gave her access to a form of medical intuition that operates faster and more accurately than traditional diagnostic thinking, Dr. Williamson concluded. Inspired by her research into Sarah's abilities, Dr. Williamson worked with Sarah to develop training programs that could help other physicians develop enhanced diagnostic intuition. The program, called Integrative Diagnostic Awareness, taught physicians to pay attention to subtle patterns, trust their intuitive impressions, and integrate holistic patient assessment with traditional medical analysis. We can't replicate Dr. Chen's near-death experience, Dr. Williamson explained, but we can teach physicians to use the same kind of pattern recognition and holistic assessment that makes her so effective. The training program was remarkably successful. Physicians who completed the program showed improved diagnostic accuracy, caught serious conditions earlier, and reported greater satisfaction with their ability to help patients. Dr. Maria Santos, who participated in the program, described the transformation in her medical practice. Sarah's approach taught me to see patients as whole people rather than collections of symptoms. I'm catching conditions now that I would have missed before, and my patients are getting better care as a result. 5 years after her near-death experience, Dr. Sarah Chen had become an internationally recognized expert in what medical schools now called intuitive diagnosis and consciousness-expanded medicine. Her diagnostic techniques were being taught in medical schools across the United States and in 12 other countries. Research centers had been established to study the relationship between consciousness states and medical intuition. Dr. Chen's experience has opened an entirely new field of medical research, said Dr. Robert Martinez, who directed the International Institute for Consciousness-Based Medicine. We're discovering that consciousness and medical diagnosis are connected in ways we never understood before. Sarah's own practice had evolved into a consultation service where she worked with the most challenging diagnostic cases from around the world. Her success rate in identifying previously undiagnosed conditions was over 90%, far exceeding traditional diagnostic approaches. But perhaps the most significant change in Sarah's life wasn't professional, it was personal. Her near-death experience had fundamentally altered how she understood the purpose and meaning of her medical practice. Before my cardiac arrest, Sarah reflected, I was a good doctor, but I was focused on diseases rather than people. My near-death experience taught me that healing isn't just about fixing medical problems. It's about understanding the whole person and their place in the larger web of human connection. Sarah had developed close relationships with many of her patients, following their progress long after their initial treatment and often becoming a source of ongoing support and guidance. Dr. Chen doesn't just treat my medical condition, said Mrs. Rodriguez, the patient whose heart attack Sarah had diagnosed during her first moments back from clinical death. She cares about my whole life, my family, my emotional well-being. She treats me like a complete person, not just a medical case. Sarah had also developed a deeper understanding of her own life and priorities. She began taking time for personal relationships, developed close friendships with colleagues, and even began dating for the first time in years. Sarah never claimed to fully understand what had happened during her 7 minutes of clinical death. She avoided supernatural explanations, focusing instead on the practical applications of whatever enhanced abilities she had gained. I don't know if what I experienced was spiritual, neurological, or something else entirely, Sarah said during a television interview. What I know is that it gave me tools to help people in ways I never could before. Whether the explanation is scientific or beyond science, the result is that more people are getting the medical care they need. Research into near-death experiences and enhanced consciousness continued to grow, with Sarah's case serving as one of the most well-documented examples of how consciousness alterations could lead to improved medical outcomes. Dr. Williamson's ongoing research had identified dozens of other healthcare workers who had experienced enhanced diagnostic abilities following near-death or other consciousness-altering experiences. Dr. Chen's case isn't unique, Dr. Williamson explained. We're finding that consciousness expansion, however it occurs, can sometimes lead to enhanced pattern recognition and intuitive abilities that translate into better patient care. The medical establishment's response to Sarah's case and similar phenomena had evolved from initial skepticism to serious scientific investigation. Dr. Patricia Chen, no relation to Sarah, who directed the National Institute of Health's research into consciousness and medicine, explained the significance of Sarah's case. Dr. Sarah Chen's experience challenges us to expand our understanding of medical diagnosis beyond purely analytical approaches. Whether her enhanced abilities result from neurological changes, increased pattern recognition, or something we don't yet understand scientifically, the practical results are undeniable. She's saving lives and teaching others to do the same. Research centers at major universities had begun studying the relationship between consciousness states and medical intuition, with Sarah's case serving as a foundational example of how enhanced awareness could translate into improved patient outcomes. Today, Dr. Sarah Chen continues to practice emergency medicine at Memorial Hospital, where she serves as Director of Integrative Diagnostic Medicine. The 12 patients she diagnosed during her first moments back from clinical death all made full recoveries, and several have become advocates for the consciousness-based medical approaches that Sarah helped pioneer. Her diagnostic techniques are now taught in over 200 medical schools worldwide, and the Integrative Diagnostic Awareness Program she helped develop has trained thousands of physicians in holistic patient assessment approaches. Sarah's near-death experience created ripples that continue to spread throughout the medical community, observed Dr. Rodriguez. She's changed how we think about diagnosis, patient care, and the role of consciousness in healing. Her 7 minutes of clinical death have led to improvements in medical practice that will benefit patients for generations to come. Dr. Sarah Chen's 7 minutes of clinical death and subsequent return with impossible diagnostic knowledge challenges our understanding of consciousness, medical intuition, and the mysterious connections that exist between human beings. Whether her experience was neurological, spiritual, or something beyond current scientific explanation, the practical results are undeniable. 12 lives were saved in a single day, thousands of physicians have learned enhanced diagnostic techniques, and countless patients have received better medical care. My near-death experience taught me that healing is about more than just medical knowledge, Sarah reflects. It's about connection, connecting with patients as whole people, connecting different pieces of diagnostic information into complete pictures, and somehow connecting with forms of knowledge that exist beyond what we can learn from textbooks. Sarah's story reminds us that the boundaries between life and death, between known and unknown, between scientific and mysterious, may be far more permeable than we imagine. Her second breath brought with it not just a return to life, but a transformation in how life could be saved, healed, and understood. In a world where medical practice often focuses on technology and specialization, Dr. Sarah Chen's experience proves that some of the most powerful healing comes from expanded consciousness, enhanced intuition, and the mysterious ways that knowledge can transcend the boundaries of individual experience. The second breath that returned Sarah to life brought with it insights that have revolutionized medical practice and saved thousands of lives. Her story offers hope that consciousness, healing, and human connection operate in ways far more profound and mysterious than conventional science has yet discovered. Whether Sarah's experience represents a glimpse into the true nature of consciousness or simply demonstrates the untapped potential of human intuition, her legacy continues to expand through every physician she has trained, every patient she has saved, and every life that has been improved through the diagnostic approaches her miraculous return to life has made possible.